with respect to breast cancer. But it's very important to emphasize that the investigators concerned consider the results to be far from conclusive. This was for two main reasons. The first was that the number of breast cancers was very small, which means that these findings could have occurred by chance. And the second, as with the Swedish study, was that the patient groups were very different, which means that the differences in cancer risk might not be related to the type of insulin they were using. In other words, it's possible to say that more women treated with Lantus alone developed breast cancer in Sweden and in Scotland, but it's not possible to say that their breast cancer was in any way related to the type of insulin they were using. Finally, a fourth study, also commissioned by the EASD, examined cancer risk in relation to a range of different therapies for diabetes, and we'll come back to these findings in a moment. For present purposes, however, we can note that this study found no increase in the risk of any type of cancer, breast cancer included, in patients treated with Lantus. So this was a negative study. The sample size was, however, smaller than in the other studies, and once again, it allows no definite conclusions to be drawn.
We believe that people are entitled to know that use of Lantus insulin might be associated with greater risk, but this must also be balanced against the possibility that we might be causing unnecessary alarm by raising these concerns. Consideration of the facts will not be helped if alarmist headlines appear in the newspapers. Before we try to reach a conclusion, therefore, a number of important points need to be made. The first is that there is no question whatsoever that Lantus, or any other insulins included, actually causes cancer. Cancers typically take many years to develop, and the reports we have been discussing all relate to a very short period of treatment. The question, therefore, is not whether this type of insulin causes cancer, but whether it causes existing cancer cells to grow and divide more rapidly, which might explain why more cancers came to be diagnosed over such a short period of observation. The next point to make is that large observational studies such as these are notoriously hard to interpret. We can detect differences between groups, but we cannot be certain as to the reasons for these differences. There are also a number of unexplained puzzles arising from the studies we have discussed. For example, why patients on Lantus alone should apparently behave differently from patients on Lantus plus a quick-acting insulin. So then, what conclusions can we draw? It's important to emphasize that we have no conclusive proof that Lantus is associated with a higher rate of cancer. The German study is suggestive, but it relies on statistical correction for insulin dose. The Swedish and Scottish studies are essentially negative in all respects except that of breast cancer. Individually, as we have emphasized, neither study is in any way conclusive. Taken together, however, they make it clear that there is indeed a case to answer. So how can this be done? Well, EASD has already communicated these findings to EMEA, the European regulatory authorities, and we're now in contact with Sanofi-Aventis, the manufacturers of Lantus. A large combined analysis of the best available databases worldwide is, however, the best way forward, and EASD and Sanofi-Aventis are pledged to carry this investigation forward until we have either confirmed these preliminary observations or, hopefully, finally put them to rest.
In the meanwhile, what do these findings mean for people on insulin? The most important thing to emphasize is that the safety of insulin therapy is established beyond any doubt. The safety of insulin has not been affected in any way by this very searching analysis. The concerns that have been raised only affect one particular type of insulin, and then only when this is used on its own. There is no need for concern if you're using human insulins, or the rapid-acting analogues such as Novorapid, Humalog, or Apidra. There is another long-acting analogue called insulin detamir, otherwise known as levemir, which is modified in a different way from Lantus. Levemir was introduced more recently, and we've yet to examine it in the same way as for Lantus. The concerns raised by these studies therefore relate only to Lantus and only to Lantus when used on its own. There's currently no evidence whatsoever of increased risk in children or younger people on multiple injections of insulin. Furthermore, 3 of the studies found no overall increase in cancer risk in patients taking Lantus on its own or with other therapies as compared with human insulin. Although, as we've said, 2 of these did observe an increase in breast cancer in women taking Lantus alone. To give you an idea of the scale of this risk, the added risk of breast cancer, if confirmed, would be of the order of 1 or 2 extra cases diagnosed each year for every 1,000 women using this insulin. The German study did, however, suggest a small all-round increase in the likelihood that any cancer might be diagnosed in someone with diabetes of either sex. And further breakdown of this information will become available later on in the year. Finally, we do have some good news to announce, arising from one of the 4 studies which examined all forms of diabetes treatment, tablets included, in relation to the risk of cancer. It's already been shown that people with diabetes are less likely to develop cancer, as compared with other diabetes treatments, if they take a tablet called metformin, which has been available for many years. Metformin is readily available, it's safe, and it's effective. Our 4th study provides further evidence that metformin use is associated with a lower risk of cancer, whether taken on its own, or in combination with other tablet treatments for diabetes, or in combination with insulin. So, if you're concerned about these findings, you should discuss them with your doctor or your diabetes specialist. You should on no account stop taking your insulin, for uncontrolled diabetes is very dangerous. If you're a woman with type 2 diabetes, you have the option of changing to the human insulin equivalent of Lantus, which has been shown to be equally effective in controlling blood glucose levels. This may be of particular concern to you if someone in your family has previously developed cancer of the breast. And finally, we would emphasize that Lantus is a very popular and effective form of insulin. It's helped many people to achieve better control of their diabetes. And our advice for the great majority of patients is to keep on going as you are with this insulin until further information becomes available, which shouldn't take us more than a very few months.
So, in conclusion, there are important questions which need to be answered with respect to the safety of Lantus when used alone, but there is no clear evidence pointing to an increase in cancer risk. If you or someone close to you is taking this insulin, there is no immediate need for action, and you should certainly not stop taking Lantus until you have the opportunity to discuss these issues with your doctor. The European Association for the Study of Diabetes is working hard to clarify these issues, and we will inform the members and the public of new developments. And the new data will be presented at a special symposium on the occasion of the EASD meeting in Vienna in September of this year. So we thank you very much for your attention.